So, what are the complications of tracheostomy? The complication of tracheostomy can be divided into three types: immediate, intermediate, and late complications. The immediate complication happens at the time of operation, whereas the intermediate operation takes place during the first few hours to the days. Okay, and then we have the late complications that usually happens after weeks or month of tracheostomy. In the immediate complication, the first thing that we have is hemorrhage. So hemorrhage happens from anterior jugular vein and inferior thyroid artery. Similarly, the hemorrhage may be from the thyroid emi artery. Similarly, the second complication that we see immediately is apnea. Apnea is due to sudden washing out of carbon dioxide during the time of surgery. How do we manage the case? We manage the case by administering carbogen. What is carbogen? Carbogen is the mixture of 95% oxygen and 5% carbon dioxide to re-stimulate breathing. Okay, then the third complication that we may experience is in pneumothorax. Similarly, we have subcutaneous emphysema, and the another complication may be injury to the esophagus. Okay, and similarly, what we have the immediate complication is inspiration or aspiration of the blood. So before moving any further, one thing to add is what type of tube is used in tracheostomy. So basically, the tube that is used in it may be metal tube or it may be the Portex tube. So metal tube is also known as Jackson silver tube. It has double lumen and is used and it exerts high pressure upon the surrounding organs, mostly trachea. Similarly, the second tube that we use is made up of polyvinyl chloride, PVC, also known as Portex tube. So what happens is in the Portex tube has a high volume and low pressure and is more flexible. So in compared to Jackson silver tube, Portex tube is more reliable and has more advantage because what happens is, listen, so what happens is in the Portex tube, okay, in the Portex tube there is less chance of fibrosis, so it is better used. Now the intermediate complication that happens in the first few hours and can happen up to days. So what are the intermediate complications? The first one we may experience is reactionary hemorrhage or bleeding. Similarly, the second one is that displacement of tube may occur, and similarly the blocking of the tube also may occur. Okay, then third we have is subcutaneous emphysema. That is also one of the emphysema is one of the complication. Similarly, what we can have is tracheitis or inflammation of trachea and bronchi, so known as tracheobronchitis, which can cause crusting in the trachea. Similarly, long abscess and atelectasis can also manifest as intermediate complication from the first few hours to 1 or 2 days.